Good morning, everyone. This is Michele Hughes from Ageless and Timeless. Today I have Dr. Robert Weber, who I've been speaking with for the better part of this year, and he lives in Germany, so it's 9 hours ahead for him. He's being very cooperative and staying up for us. So thank you so much, Robert, for joining us here at Ageless and Timeless. Welcome.
Yeah, thank you very much for the invitation. Very happy to be here and share some insights on our work about photobiomodulation and laser therapy today.
And we love your accent, by the way.
Thanks.
So, all right. Well, we want to dive in. So, why don't you tell us a bit about you first, who you are, your journey to where you are today at Weber Medical, and any of the steps along the way that you think are informative to and transformative to who you are and what you're doing. So, why don't you just dive right in?
Okay. As you already mentioned, I basically represent our family business, Weber Medical. So we are like the very first or one of the very first companies or businesses in the world, working in this whole field of laser therapy, or nowadays also called photobiomodulation. So the main background of this whole history is that my father, he's a medical doctor and also a biochemist, and he was working in medical practice for more than 25 or 30 years until the late 90s. But he was always facing lots of limitation when we talk about conventional medicine. And he was always looking for other modern approaches to help, especially all his chronic patients. And at that time, first data came up showing evidence that light therapies, especially laser-based therapies, can be very beneficial in pain management, in acupuncture. In the beginning, we had very good data. And so he used a lot of those technologies on his patients, where regular medicine did not really work or show any benefits. And he very often saw really dramatic improvements. And this was basically the starting point to decide to create his or our own technology. So very advanced laser technology, multi-channel laser systems, where you can treat basically multiple points, multiple areas on the body at the same time, with deep penetration into the body. So you can really bring in significant amounts of photons, so of light energy, to restore, to regenerate tissue in the body. So again, in the beginning, mainly on pain management. But later on, we also realized or came across lot of good research from especially Eastern Europe, where they were using lasers also systemically by bringing laser directly into the blood flow, for example. May sound a little bit futuristic to some people, but this has been done, especially in Russia, for more than 40 or 50 years. Mm-hmm. Even in the big university hospitals, after surgery, they put the laser into the bloodstream to basically stimulate all the cells in your flowing blood, like stimulate your body's own stem cells, stimulating mitochondria. So this way you can really, give the body a boost or to help it regenerate itself. And the data has been really good from Russia or from Eastern Europe. And then, as I said already, we created our own device now more than 20 years ago already. We did a lot of medical research on our patients, but also in cooperation with lots of good universities and other clinics worldwide, where we could basically show all the evidence how successful this light therapy can be when it's used with the correct protocols, in synergy with other therapies. And so this has been a long journey now. I grew up with this basically. So I joined the whole company or business then, also almost 20 years ago. And so we were basically like splitting it a little bit, that my father is running more the clinical side. He's treating the patient, developing the clinical protocols. And I was focusing more on really educating people, creating the research studies, bringing this whole new therapeutic option into the world.
So when low-level lasers, I guess that's the technical name, LLL, and then is it LLLP?
LLLT for therapy, low level laser therapy.
LLLT and photobiomodulation. So when did you turn the corner from the basic light therapy, because we all know that we're energetic beings and that light can obviously affect us in the mitochondria, of course, the key to our health. So when did you turn the corner to going towards the IV side, where you were actually affecting the mitochondria with low level laser therapy?
Yeah, what we realized, of course, when we talk just about topical applications of light, that we have certain limitations. So, of course, that's what usually everybody can understand easily, that we can have very good benefits just from sunlight, for example. We all know that we need the sunlight for vitamin D production, many other metabolic processes. But our skin is also like a barrier. It's made to protect us, and so light, like diffuse light from sunlight or from lamps, cannot really penetrate deep into the tissue. So it might penetrate into the superficial layers of the skin and do some benefits in this area. But if you want to go deep into the body, so let's say we want to regenerate tissue directly inside a joint, or you want to do it on a systemic level, what I already mentioned when treating the whole blood flow. This is something which is, where you need very special technology, where you need to have focused light going directly into the tissue, so that you have a really sufficient amount of light photons really stimulating the cells. And this is basically the technology we have been developing and working on and researching for the last 20 years.
Now, are you the only company that is doing IV photobiomodulation?
Yeah, basically on an international level, I would say yes. Of course, there are some other more simple devices, the ones that have been there in the past in Russia, but small, very simple, limited devices without, of course, very important, without medical approval. So if you want to use it here in the US or in Europe, you really have to make sure you get the approvals, and we have the CE approvals in Europe. We have the FDA approval in the US, and of course, this is something you can only achieve when you do a lot of work with the research studies, and you have
and very expensive work and very lengthy time frame. So this is really a big credential for Weber Medical, that you are FDA approved, and you're what's it called in Europe? Your FDA?
It's called basically CE. It's a CE mark, yeah.
So, and is that all of Europe, like, or is that just in certain countries?
No, it's basically valid for whole Europe, or at least for the European Union.
For the Union. So does that include Great Britain, since they're not in the European Union?
Yeah, they still accept it. They just left the European Union a couple of years ago, so They have their own legislation now, but they usually accept the CE mark, so we can ship products to the UK without any issues.
So, Robert, what's the biggest challenge that faced you as you navigated this journey from 20 years ago?
Yeah, well, the whole field of medicine is like a very often a kind of conservative area. So it's very difficult if you want to approach people like medical doctors who are really, stuck in this Western conventional medicine field. So, of course, everything is opening up now. People are looking more and more for alternative options. We all know that conventional medicine has its limitations, and that many people don't just want to treat the symptoms by taking another pill. They really want to go to the root causes of disease, and this is something we are working on. When we bring such specific wavelengths of light directly into the cell, we really want to go to the root cause of disease, and we really want to give the body the ability back to restore, to regenerate itself, and not just working on symptoms of disease.
Today's podcast is brought to you by International Anti-Aging Systems and Profound Health. The founder, Phil Mickens, has been a guest on Ageless and Timeless, and those who know him personally, as I am so fortunate to do, can attest to his knowledge, experience, authenticity, and his passion to help make the world a better place, with a commitment to work profoundly to improve our health. I personally have used the peptide bioregulators, some of his hormones, and his skincare products, and I can attest to their efficacy. If you want those unique and value-added evidence-based health products, then IAS and Profound Health are your number one resource. We're going to flash on the screen the different websites that you can use in order to order their products. And no matter which website you go to and which products you order, please use the Ageless code for a 15% discount.
So one of the biggest biohacks today is plasmapheresis, where through an IV, the blood is taken out of the body, or some of the blood, not all of it, of course, and then ozonated and then injected. So how does your light therapy conjugate, let's say, or combine with the plasmapheresis? Would that work together?
Yeah, absolutely. I'm always telling people the intravenous systemic light therapy is just in perfect synergy with so many therapies, because one of the key effects of the intravenous laser is that you are really also opening up the microcirculation. So you can combine it with infusion therapies, with nutrients you're giving to your body, because everything can be absorbed better in the end when you combine it with a laser. And you also basically activate all the cells in your bloodstream. You're opening up detox pathways. So there are so many good effects on a cellular level, which can work in synergy with other things. We have people combining it with stem cell treatments, with exosomes, with plasmapheresis, with oxygen, hyperbaric oxygen, with ozone. So there's no contraindication. It's just a perfect synergy, and yeah.
Right. I'm heading over to this weekend to meet Ed Clay. Are you familiar with Ed Clay and the CTI Center in Tijuana? Okay. When we get off our call, our podcast, Google them, because they may be a really good prospect for your treatments. They are basically a hospital licensed in Mexico, plus a stem cell clinic. But they do all the protocols you just mentioned, but they don't do the laser therapy. So this could be a really good adjunct to what they're doing. And I'm happy to introduce you to Ed. He's one of the co-founders. So let me know offline whether you want me to take another step and provide an introduction. So those challenges that you faced were really the medical establishment and the allopathic approach versus the functional medicine approach. Do you combine any allopathic treatments with your functional medicine photobiomodulation treatments?
Yeah, absolutely. So we are also we are German guys. We are very scientific driven. So we are not using just alternative approaches. So we are also always cooperating with university centers, with other clinics. We are not telling people stop your regular medication. So we try to find the synergy. Sometimes it's also successful if you can just reduce, for example, the amount of pills you are taking. But of course, it's also working in synergy with other approaches. We are also, just to give you an example, one of the main focus in our clinic in Germany is actually cancer therapy. And we are also not telling people like stage 4 cancer patients to stop their chemo. We also work with oncologists who are doing radiation and chemo. And then we try to incorporate our technology to maybe reduce, on the other hand, the dose of chemo.
Mm-hmm. So is there more acceptance now of your functional treatments by the allopathic side of the equation?
Yeah, I would say it's growing for sure. Right now we have a hype in general when we talk about biohacking, about longevity. Everybody now is talking about red light therapy. So this whole field of light therapy, photobiomodulation is coming more and more into the mainstream. And of course, also many conventional doctors, they are more open to such approaches.
Mm-hmm. So let's talk about who inspired you. Obviously, your father was a key one, but just go through some of the mentoring that you've had along the way, and how that has affected you, and creating who you are today as a medical professional.
Yeah, well, that's one of the advantages, of course, when you do such a journey for 20 years. When you're traveling the world, you meet so many great people, great doctors in Europe, in the US, at the conferences. And yeah, you already mentioned, of course, my father, he's like the leading expert behind this. But also, when you look at the conferences, we always bring together amazing people. For example, Dr. James Laporta from South Africa. He's a fantastic doctor in the field of integrative cancer therapy. Also, Tony Jimenez. Maybe you know him from the Hope for Cancer clinics in Mexico. He's also a very good friend, and I think they're doing a great job. Then we are working very closely with Paul Anderson here in the US, a very probably one of the most famous naturopathic doctors in the US. Yeah, we have amazing people in the field of orthopedics, great biological dentists in Germany, for example. Very famous right now is Dr. Dominik Nischwitz, bringing the laser into the field of biological dentistry. So, yeah, it's growing in all different areas of medicine right now.
Mm-hmm. Just so you know, Ed Clay's hospital is literally next door to Tony Jimenez Hope for Cancer, and they really do collaborate because of their their combined objectives of curing cancer is one of their protocols. So yes, I do know Tony. I've known him for about 25 years. So visited with him back in 2004. When it was just not for my own not for, thank God, for any treatment, but I did see a lot of the patients there that were being treated and doing the things that were at that time very experimental, and including stem cells, which were in their infancy in 2004, of course.
Yes.
So okay, so you mentioned some of the people that inspired you. Who do you aspire to be? What is your vision of where Robert Weber is going to be, to where you are today and where you're going?
Yeah, one of the main areas of interest for me in the beginning was also, when we talk about photodynamic therapy, was the field of so-called antimicrobial photodynamic therapy. So because this photodynamic approach does not only work against cancer cells, it's also working against all different types of pathogens, especially in the bloodstream. So you can kill viruses, you can kill bad bacteria, parasites. We did amazing research on malaria in Africa. So I think that's a very exciting field with all those chronic infections going on in the world. We had all the viral issues with the COVID and things like that. And we have amazing natural approaches here with photodynamic therapy. So this is one of the core areas where I really want to see the field growing. And this is, also one of my main expertise, because we were the very first group to publish studies in this field showing that, there has been a lot of in vitro research being available also from the US universities, where they could show on blood in vitro that it's killing all different types of pathogens. But we have been basically the very first group to bring it into clinical practice. So this is one of the very exciting fields. And then, of course, this whole field of treating neurodegenerative diseases, so everything related to the brain. As you know, we are just about to launch a very new helmet type device with a couple of 100 laser diodes inside, where you can really bring red and especially infrared light directly into the brain. And this is opening up now with the advancement in technology, so that you can bring a lot of lasers relatively affordable now, with high power, with good focusing, so you achieve a really good deep penetration into the brain tissue. And this is, it might be a game changer for treating everything related to the brain. Just think about dementia, Alzheimer's disease, think about Parkinson's, stroke recovery, mental issues. We are talking about more than 1 billion people worldwide suffering from mental or neuro conditions, and there are not too many good treatment options available for such diseases. And there are already good studies available, even from Harvard University, showing how beneficial infrared light can be for brain tissue. And now we are just about to launch the very advanced technology. I think this might be a very maybe the most interesting field of research now for the next few years.
So how do you compare that product innovation with what Sarah Turner is doing with the gut and the brain helmet that she has?
Yeah, there are. I know her. I know the technology. There are other good technologies on the market as well, of course, like hers. There's a V-Light company. There's Neuronics, so a couple of brands now coming onto the market with technology because the research is so promising. But the main difference is they are all working with relatively old or relatively simple LED light technology. You know, the difference between LEDs and lasers, we always have to differentiate. So a laser is a coherent light, and this way, especially when you focus it with a good lens technology, you achieve a much deeper penetration. And LED technology is not bad, but the limitation, especially when you want to go through the skin, through the skull bone also, and you want to go deep into the brain, it's very difficult, or I would say almost impossible, to do it with LEDs. And laser technology is giving you more opportunities.
So you're the only company using the laser technology versus the LED at this time.
This is what we are just about to launch the product. We have been developing this now for almost 2 years, and I can tell you it's been a long, difficult, and very expensive project as well.
Yes.
But we are such strong believers in this, and I think the laser technology will make a significant difference compared to all the LEDs.
And how is this going to be connected to the microbiome? Like, obviously the gut-brain axis has become a very big subject matter in medicine today. So how would your helmet affect the microbiome if it's being worn on the head and it's being focused on the brain?
Yeah, this helmet is mainly focusing on the brain, but of course you can combine it here. Now we talk about synergies as well again. So you can, for treating the gut area, there are so many technologies out there. You can use a topical laser device, place it on your stomach, on your gut, and bring the light and combine it with that. So that's of course beneficial in many areas when we talk about this microbiome connection.
I'm very interested in this because I think it's something that will capture a lot of attention, particularly because of the numbers, the metrics involved in dementia and Alzheimer's, and that it's growing, and that the aging of the population, and just the fact that Alzheimer's has been such an abysmal failure in terms of the allopathic side, in terms of all the money. $40 billion has been spent and really no cure. So this is really exciting what you're talking about, but because it's advanced to the gut brain axis and you want to combine them, if somebody were going to purchase your product for the brain, the helmet, where would you send them to purchase a laser that will do the work to combine synergistically with yours for the gut?
Well, we also do have technology available also for home use, like infrared pads, which you can place on the area from outside. So, of course, here it's the same thing like with the brain. You have to make sure you achieve a really deep penetration. So, to be honest, I'm afraid with LEDs, it will be also difficult to really go deep into to achieve a deep penetration into the gut. So probably you need a more advanced clinical laser system for this. So it might be in a clinical setting, or there might be also lasers for home use. But again, our main focus now of research has been especially on the brain technology. But I'm not too afraid to find solutions for the gut as well, because this is a more simple approach to bring the light here.
Well, I saw online that your father was doing IVs. He showed the product that you have in the clinic, where you do the green light, the yellow light, and so forth. But why couldn't that be adapted to the gut? or am I off base on my supposition?
Well, here it's again the same thing. It's always about penetration, and especially when we talk about the lower wavelengths of light, which you just mentioned, like the red and infrared, which are more on the upper side of the wavelengths. Red, they can penetrate relatively well, but the
Right.
lower you go towards the spectrum of light. So first you have the yellow, then the green, then the blue, then the ultraviolet, and the
Right.
lower the wavelength, the weaker the penetration into the tissue. And it's very difficult, of course. When you have very thin layers of skin, you can bring some of the energy inside. But if you want to go through the stomach, deep into the gut, it's not possible with the lower wavelengths.
Okay, so there's not a pluripotency kind of situation that you could go in through the arm with an IV, like he was doing for orthopedic, some injuries on the internet. That the sites that I viewed, he was working with, I think, cancer patients to avoid chemotherapy, but also for injuries. Am I correct on that, Robert?
Yeah, of course. We are also doing a lot of those treatments, what you already mentioned. For cancer, you can bring laser light directly into the tissue by this interstitial technology. We do ultrasound guided injections, go very close to tumors to irradiate it with infrared or red light. And of course, you can also do this for joints in regenerative medicine. We go with needles into shoulder, knee joints. And this way, when you're inside the tissue, inside the joint, through the skin, of course, then you can also apply blue lasers or yellow lasers, which have very strong effects, very good anti-inflammatory effects, very good effects on stimulating stem cells and exosomes. But it does not work from outside. This is the crucial thing here.
And I was just about to ask you that question. So are you combining exosomes and peptides with your IV treatments for laser, for photobiomodulation?
Yeah, absolutely. This is also one of the growing areas right now in regenerative medicine. Again, we have all those synergies. We know from latest research when we talk about intravenous IV laser that just the laser alone has already amazing effects on your body's own stem cell production. So we have very good data now from a very famous doctor from India who did a lot of research on that, showing that stem cell numbers are really increasing, like doubling after 5 sessions of intravenous laser, that telomeres are increasing in length again after intravenous laser. So you have an amazing anti-aging or longevity tool with the intravenous laser. Also, like natural killer cells, everything can be measured that the numbers are increasing significantly just with a laser. But then, of course, if you inject something like stem cells, like exosomes, you can really potentiate them with the lasers significantly as well. And this is also an area where we have a lot of good publications available. Showing especially for stem cells that when they absorb the light energy, they are better when it comes to cell survival, to differentiation in the tissue. So it's a very big boost for those cellular therapies.
Mm-hmm. So let's take a closer look at Weber Medical and your company's products. We're obviously talking about some of them right now, but let's go through the different products, what they do, and particularly I would like you to focus on the consumer, because that's the area you head up where you started, right? And and I have on my watch that you sent me, so I want to go through. I want us to go through and talk about that a little bit. So start from the top for the clinical side, and then go down to not down, but go to the consumer. If you could just go through the different products and what they each do and where they are in development.
Yeah, so our main background again has been in the clinical work. So our main product has always been the bigger clinical laser unit, which is used for all those injection therapies, for this IV therapies, what we now already talked about, which we are using in cancer therapy, in chronic infection, and in regenerative medicine in our clinics. But especially as we see so many international patients in our clinics, they're traveling from all over the world, coming for a week or two for getting such an intense treatment, and then they're leaving back home. And they were always asking us, what can we do? Do we have a practitioner nearby? But if not, what can we do to maintain the effects of this therapy? Do you have any recommendations or any products you can recommend to us for home use? And yeah, this has been basically the starting point for us to develop or create also special tools, to give the patient the ability to continue treatment at home. And we've already talked now about this infrared helmet, where we are now launching the second generation one, where we will have a clinical version on the one hand, so with even more laser diets, with lots of options for protocols to target different areas of the brain. But this will be something more where you have to be a good or well-trained practitioner. But we will also have a home use version. Again, when we talk about neurodegenerative conditions like Parkinson's or dementia, you really need an ongoing treatment for sure. It won't be done with like 5 or 10 treatments in a clinical setting. In such degenerative processes, you need ongoing treatment to supply the energy to the tissue, basically on a daily level. And therefore, we will also have a home use model for this helmet technology.
Mm-hmm.
And then when we talk about the systemic approach again, what we are doing intravenously with the laser in the clinic, for that, we created this so-called, now called Endolight, or also before it was called Laser Watch, because it looks a little bit like a watch, or it's worn on the wrist like a watch, but actually it's worn on the inside of the wrist,
Right.
where you have your two main big arteries, you have a very strong blood flow, and you have very thin skin. And here again, we have the advantage. We don't need to overcome thick skin here. So we have the ability, if we have high-powered, well-focused laser diets, to really penetrate through the skin directly into the bloodstream.
Mm-hmm.
Of course, it's not 100% the same like doing it intravenously. Again, especially the higher wavelengths like red and infrared penetrate pretty well, but the lower you get, like with blue or yellow, it becomes more difficult. But here on this area where the skin is typically really thin, you can bring good amounts of energy also inside the tissue. And if you do something like that every day for an hour or so, you have an ongoing treatment for yourself every day. You don't really feel it at all. You can work around, you can work with it. It does not limitate what you're doing. But you have a constant energy support for your body, constant stimulation of your mitochondria, of your immune system, of your microcirculation. So it's amazing for prevention, but also for treating chronic condition. You can combine it, if you take nutraceuticals like supplements, what many people are doing these days, you take them before, have them in the blood flow, and then you do the systemic therapy with the light to open up the microcirculation. Everything will become a little bit more effective with that approach. So
Robert, is there any way you can measure the results that you're getting by any kind of lab work, or in other words, how do you know that watch is actually making a difference?
Yeah, of course, we also did a lot of different tests in the beginning. So we did autonomous nervous system tests, for example, where we see immediate effects on the parasympathicus. Then we also did a lot of measurements like on melatonin, for example, on serotonin, you have very positive effects. Then we get amazing feedback from patients, like we have diabetes patients, who are on regular medication for many, many years. And now they're using this technology, and the lab values, they basically come back into a normal range. So you can typically measure it pretty well in the lab values.
As long as we're talking about that, I just realized my time on my watch. I've got to put the new, so it's 30 minutes. So let's go through and talk a little bit about the 3 settings. Okay, so I'm using right now what you're using, which is the heart setting, and I'm now setting it for the highest. With the rainbow, it's the highest. So, and then I set the time for the maximum, which is 30 minutes. Okay, so in those 3 sessions, what's happening to me and to you, because we're both doing the same thing at the same time here. So what's happening to us that is going to change the dynamic of our bodies during those 3 sessions?
Yeah, we have we have different programs in this product. So what we also already talked about is that the different colors or wavelengths of light have different cellular effects. So when we talk about red infrared light, they mainly boost mitochondria. They are giving the energy. So therefore we have this like activation mode, or where you see this like a athlete on the display of the watch.
Right.
So this is basically the program where you're focusing on supplying more energy into the cells.
Right.
Red, infrared, and green light also, which are the most effective ones for stimulating mitochondria. Then you also have this balancing mode where we are using the colors like blue and yellow, which are basically bringing down inflammation in the body and really helping the body to relax better. And so this is a nice program people can use in the evening before going to bed, for example. But then, of course, the most common program is what you already mentioned, the heart mode, where all the colors are on at the same time, because they don't really work against each other, but they all have their unique cellular effects. And especially if you combine it with nutraceuticals, or you want to treat a specific health condition, then we usually recommend to give you the full benefit of all of the different light wavelengths. And then we have the infrared, red, blue, green, and yellow light included.
So, like for example, this morning I take urolithin A, which is, as you know, Timeline is the company that produces that product, which improves the mitochondria. Which, as we've already said, the mitochondria is the key to our health. Okay, all health begins in the cells, and so you want to create more ATP. So if I put the watch on after I've taken my morning supplements, which including the urolithin A, there's going to be an adjunct improvement because of the light combined with the supplement. That's what you're saying? So it is a good idea to do it first thing in the morning with the heart one, and taking your supplements. That I always take the ones on an empty stomach as soon as I wake up. And then after I eat, I take the other ones. So then you could do the energy one, the athlete, because then usually I'm going to work out anyway. You know, my whatever workout I try to do daily. So the athlete one would be good to wear while you're working out or before.
You could do it during the workout as well, but usually most people would do it before, also because, when you're really working out, maybe you're sweating, it's not, probably not that convenient, but doing it right before is a good idea. And that's absolutely the main effect. You stimulate your mitochondria, you really give your body the ability. And, we have really good data studies available from athletes that in the beginning, mainly with the intravenous laser, that endurance is increased significantly, that maximum power in weightlifting is increased significantly. Then with this watch type device, we did some tests on runners, on marathon runners, and all of them, they could increase their performance, their best possible time in a marathon significantly. So it's really good on the one hand to give you more energy, to improve endurance and maximum power, but also for after the workout, it's also pretty nice to give the body energy again to regenerate faster.
Oh, that's good. So we've talked about the helmet for clinical use and the helmet for home use. Now we've talked about the laser watch, which is a consumer product that you created in your division there. And what else is there that you want to tell us about? And then I want to talk about the prices for each for the consumer, in case any of our viewers want to order. Like, I would highly recommend our viewers look carefully at the watch, because that's an affordable option, and it's something, if you're using the Aura ring and things like that, the wearables, this is something that's really an add-on that is, I think, vitally important to add. So I'm not trying to plug you, even though I'm very pro the watch because I use it all the time. But I do want to, be sure that viewers understand what its uses are, and also the pros of using it. So go back to, we've got the helmet, home and clinical, and the watch, home. What else?
Yeah, I think we covered the most important ones. We also have some red infrared like pads, which you can use on specific areas, on pain areas or on joints and things like that. But yeah, here we can just be honest, that is not the most special technology. There are so
Yeah.
many red infrared light therapy devices on the market right now. So I don't think we need to talk about them too much. So the most important ones we already covered and I
Okay,
absolutely
good.
agree with you.
Okay, so the only thing I would say is would be really great if we could have a laser product for the gut. That's something I put on your honey-do list or your wish list for future development, because I think that would be combining with the new helmet that's going. When will that new helmet be introduced?
Yeah, the good news is actually last week I just received the news that we just made it through the CE test in Europe. So
Good.
all the safety studies, everything is done now. So we now start manufacturing the first batch. So yeah, now it will just take a couple of weeks until the first batch will be available. And of course, we already have plenty of pre-orders, especially for the clinical version. But then for the home version, yeah, I think if people are interested in that, that can be available. Yeah, in December, January, I guess.
Okay, because I have a brother-in-law that I would love to introduce to that helmet. He lives in Miami, and you are in Florida quite a bit. You told me, right?
Yeah, usually we very often go to California. You know, we have our base in San Diego, but also to Florida from time to
Yeah,
time.
I think I remembered you telling me because I remember you told me you met Todd Ovakaitis
Yes.
and
Yeah.
you know his clinic in Carlsbad, right? Because he's a friend of mine. So all right, so what? Let's talk about the pricing. So the clinical, I don't think we need to address right now because that. Although we do have a lot of viewers who are medical doctors, so actually let's go through it. Let's do it all. So clinical use, what would the new helmet cost?
I can't tell you the exact final price yet because, as I mentioned, just manufacturing is
Yeah.
starting now. So, but it will be roughly in a range of the clinical device 15,000.
Okay. And then what about the consumer?
The consumer will be, yeah, somewhere between 4 and 5.
And there is a current product, consumer product for you told me about that's less expensive, but would you, you know, I mean, candidly, would you just say to people if you haven't bought the older model, wait for the newer one?
Yeah, I would recommend that for sure because I'm 100% convinced that this will be a big game changer compared to the LED version we had before.
Okay, and then I'm going to introduce you to Dale Bredesen. Dr. Bredesen wrote the book on ending Alzheimer's, and he's been one of my guests, and he lives here very close by where I live in California, in Marin County. But I'm sure he will want to know about this for his clinical work. So, okay, so then the watch, how much would that cost the consumer?
The watch is 1,500 euros, so 1,800 dollars.
Okay, and is that also clinically used? Do clinics buy the watch, or is it mostly?
We have also clinics using the watch. Sometimes they rent it to patients also, but also, you know, if they don't want to use the IV technology, but they do a lot of infusion therapies, they maybe give the watch to the people during the infusion. So it can be used in a clinical setting as well.
Okay, all right. And so, clinics that are currently using your products, give us some examples, just so people know if it's in their neighborhood.
Yeah, what we already talked about, Hope for Cancer, Tony Jimenez, for example. In California, we have Dr. Corneli, also quite famous in the field of cancer therapy. We have Dr. Michael Karfeld in Idaho. He's well known. We have Dr. Kaplan in Buffalo, also great doctor. Avi Herskovitz in San Francisco. He's working a
Yeah,
lot in regenerative medicine. I think
yeah,
he has 4 of our clinical units, and he also pre-ordered a couple of helmets already. So he's a big,
yeah.
big
I
supporter.
Yeah, he's very close by me. I'm in about 20 minutes from the city, and I've actually approached them. I wanted to have him on my podcast. I haven't done it yet, but I haven't confirmed him. But yeah, he's quite I would say he's entrepreneurial in a lot of what he's doing in that clinic, wouldn't you say?
Yeah, absolutely. Yeah.
Yeah. And then who was the other one in California that you mentioned after Tony?
Dr. Corneli in Irvine.
Oh, in Orange County. Okay.
Mm-hmm.
Okay. I might want you to send me a list that I can put in the show notes. Would you be willing to do that after we're
Yeah,
finished, Jay? Just send me by email a list of the clinics that I can have Roxanne, because I think people who are watching today, if it's something that's convenient for them, they might want it, unless they can come to Germany, which would be even better, right?
Yeah, that's right. But we have good partner clinics here in the US who are doing similar protocols. So,
And in Florida, what doctor there would you recommend?
in Florida, we have Dr. Albert Ray. He's a great doctor working in regenerative medicine. Who else do we have in Florida? I also need to check the list, but yeah, I
Okay.
can share that
And
with
where
you.
is that first doctor located in Florida?
He's in Miami.
In Miami. Okay, because that's where my brother-in-law lives. So that's good. I want to have him have a look at that. Okay, so let's move on to where are you going? So does Weber Medical have an exit strategy? I know it's a family-owned business, but when you talk about the future, what you can discuss publicly, what would you say is your future?
Well, to be honest, we don't have any specific future plans yet. The regular work right now, our projects for the last couple of years are keeping us so busy. So we are just, we stay involved in our projects with full heart. We are very enthusiastic, very motivated to help our patients. My father, he's 75 now, but he's still working in the clinic every day on the cancer patients to give them the best possible support. So for us, this is really something like a hard project. It's not only about business, but yeah, we are of course, but still we are also always very open to look for partners, especially here in the US. We know it's probably right now our most growing market, but we still do most of the work on our own shoulders, and we are always very open to finding good new partners in different areas for research, but also when it comes to business development.
And so what other health issues? I know we've talked about the brain, we've talked about the orthopedic, we've talked about cancer, and I assume it's all forms of cancer. What about the other health issues like diabetes, like, just, you name them, weight loss, just go through some of the other issues and tell us how your products could address those issues for our viewers.
Yeah, when we started with the systemic intravenous laser, the main things, also when you look at the old data from Russia, the most important things have been diabetes, chronic liver disease, kidney failure, and also cardiovascular disease. And, most people worldwide are still dying from cardiovascular issues. And so it can be very good for prevention here, again, because you're improving microcirculation and helping also to, regenerate organ functions and things like that by increased stem cell numbers. Yeah, so those things can be treated very well with an intravenous laser. Chronic infection is something I already mentioned. We get very good effect, like in Lyme disease and things like that. And
But like during COVID, did you have many patients who had the COVID virus and who
for COVID can be treated very well with this photodynamic approach. It's a very effective protocol where you use just riboflavin, so vitamin B2 as a photosensitizer.
Yeah.
And when you combine this with blue and ultraviolet light, it's basically breaking the DNA of the viruses, and you can basically deactivate the viruses. So we did some very good studies and published that, and it's very effective in acute stages of COVID, especially.
And what about long COVID? Because so many people are still dealing with the effects.
Yeah, absolutely. Of course, long COVID, that's a more difficult thing. People are suffering with that for many years, but at least you can do a lot of good things on the symptoms. The many people are suffering from no energy. So this is something where the laser is coming in and it's really bringing back the energy into the cells. Then many are suffering from the brain fog. Here, the helmet can really help pretty well. So yeah, we created very good protocols also for long COVID and also post-vaccine patients.
I was just going to say the vaccine has caused, it's coming out more and more now, how much damage the vaccines have done, particularly myocarditis. And yesterday I saw somebody sent me a list of Pfizer's printout, their own internal printout of how the vaccine has affected or negatively affected all these different conditions. So are you finding that you have a lot of people coming to you with the vaccine repercussions?
Well, to be honest, in our clinic, the main focus is cancer therapy. What we realized, or what we also heard from other clinics, is that especially cancer patients who, got vaccination had some kind of negative effects. Again, like recurrence of cancer, but this is more like what you heard from people. I don't have any statistical data, but it's like a feeling what you already also mentioned, that other things, bad things were happening.
If I can find that email, I'll forward it to you, because it was so frightening that and particularly that it's coming right from Pfizer. So, it's one thing if we're coming from some, independent consumer watchdog, but this is right from the company itself. So it might be a very interesting for you to see that. So what about cosmetic uses? Do you think at some point Weber Medical may want to do the combination of light therapy obviously there's a whole bunch of red light therapy devices that are using LED light, not using but how about the next generation? Do you think that cosmetics could be in your thought process?
Yeah, well, we have also been working in this field in the past as well. Dermatology in general is a field where lasers are applied very successfully. Here again, you want to treat the skin, so you don't need very deep penetration. So it's so light therapy in general is very effective for dermatology and also for skin issues like acne and things like that, but also for cosmetic treatments. You can combine it very well for people who are doing injection therapies, facial injections of PRP or other things.
Right.
Also, if you use creams like hyaluronan creams and things like that, you can combine it pretty well with lasers or LED devices. So no question about that. But to be honest, here again, this is something where you can also use more simple solutions. You don't need the very advanced high-end laser technologies, because you don't really need to penetrate that deep here. And therefore it's not the main field of interest for our products.
I see what you're saying. Okay, it's not really medically aligned with what your products do, which is far more advanced.
Yeah.
So but you have developed consumer products like the watch. So I was just, I'm just projecting. Maybe it's a wish fulfillment. I'd love to see, rather than an LED red light, a real laser red light, or all the lights that could affect the skin, because I've watched a lot of podcasts where people have been on GLP-1s and they lose a lot of weight, and then all of a sudden they have all this skin laxity because of the weight loss. Though I think there's a huge market there, because there's so many people that are using the semaglutides and losing a whole lot of weight, but they're paying the price in their skin. So have you thought about, is there any opportunity there? And I'm not trying to have you tell me about something that's confidential, but you did just say that it wasn't on your radar at the moment.
Yeah, exactly. I think it's pretty beneficial what you also already mentioned. I would always recommend like a synergistic approach of an injection therapy combined with the light therapy. I would say that would be the most promising approach here. But also right now, this is also a field, of course, where many companies coming to the market right now, also with those facial masks with LEDs inside. So I think it's also a lot of competition in this area right now.
Yeah, but this would be for the whole body, Robert. I mean, the face is really important, of course, but when people lose weight, a lot of weight, it's the whole body that gets affected.
Yeah, true.
So, well, you are so generous to offer our viewers today an incentive for at least going to look at your product. So could you go over that for us before we have to end today?
Yeah, for everybody who is interested in our products, our technology, our research, please feel free to visit our website, webermedical.com. You will find a lot of information there, also prices when it comes to the products. And yeah, we are happy also to give you like a little incentive, like a discount of 10%. I think we agreed to do the discount code ageless10 for that. And yeah, just reach out to us, and we are also happy to support, to answer your questions or send more information, scientific information. We have a lot of collections of studies on scientific material, presentations, video presentations from other doctors, so not only from us. So it's very objective also. I think the evidence speaks for itself that you can do a lot of good things with well-focused light therapies these days.
That's what I was. You took the you took the question right. It was my next question: is where can people go to look at the science? And you just answered that question. So it's right on your website. There are the scientific studies.
Yeah, you will find some of them, but if you want to dive really deep into that, just hit the contact button or send an email and ask for specific studies. Usually there are studies for everything right now available. The field of PBM, photobiomodulation, or low-level laser therapy, is exploding also when it comes to research every year. Thousands of new publications in every field of medicine, showing the evidence.
And are you going to be at the American Academy of Anti-Aging in December in Las Vegas?
We will be at A4M in December again with a booth. Yeah.
Okay. Good. So just that everybody knows, that's December 14th to the 16th in the Venetian in Las Vegas. I think it's 10,000 people will be there. It's huge. And there's over 1,000 exhibitors. But do you know your booth number so people can jot that down?
Oh, I don't know this now.
Okay.
I have to check it. But
that's okay.
For everybody who wants to pass by and maybe try it, we will have a couple of helmet, watches, IV laser, everything is there, and you can try and experience it for yourself.
Will the new product be available, the new helmet?
Well, at least we will have a couple of devices there for sure, so people can see and try it. And I guess we can also already take orders then.
Yeah. And do you work with BrainTap with Dr. Patrick Porter at all?
I don't sound familiar to me.
I don't know him. Okay, he's going to be there. He's always there. But take a look at BrainTap. They do a lot of work. They use sound, light with their helmet, and they do meditations. And it's a much softer technology than yours, but could be some synergy there as well. All right. Well, Robert, I have so enjoyed having you on my podcast today. You're really knowledgeable and very articulate about explaining to the layperson, as well as, technically. So thank you so much for allowing us to delve in and learn more about what Weber's doing and the real uniqueness of your company's technology. That's what I think should capture everyone's attention today, that this is the one company doesn't rely on LED, which is much more, it's all pervasive, but it's much gentler or much less efficacious than to be using the much more advanced laser technology. Is that a good way to sum it up, if you were going to?
Absolutely. Yeah.
Yeah. Well, the one thing I always like to ask my guests before we say goodbye is there one kernel of wisdom that you would like to impart to kind of summarize what we've talked about today, or to leave people with as they go forward from the podcast today?
Well, for me right now, I think, especially when we talk about our technologies, I would really like to to ask people to really take care of themselves and think about prevention. There is a shift in medicine right now, not only treat symptoms and really go back to the root cause of disease and do preventive approaches. Try to live healthy, give your body the support he needs with good nutrients, but also with good natural therapies. And this way you can hopefully stay away from bad disease.
Well, health is wealth. And, you know, it's interesting when you think that Hippocrates said so many, 1,000 years ago or whatever, you know, that all your health begins in your cells and your microbiome and your cells. And here we are all these years later, just learning the lessons. You know, we've been a bit slow about understanding the root cause of disease and how to, you know, basically ensure that we have a healthy lifespan and health span. So, okay, Robert, well, thank you. Have a beautiful weekend. And we'll look forward to having your list of the practitioners, clinics, so that we can put that on our show notes. Okay.
Perfect. Thank you very much again for the invitation and for